Hello, I'm back. It's good to see you again. Thanks for checking out my YouTube channel. I'm Christina, and if you're new here, I created this channel over 11 years ago when I was first looking into getting weight loss surgery. I have since had weight loss surgery. I'm 11 years post-op, and also have been since diagnosed with ADHD. I'm a small business owner, an artist, and I am just compelled to keep up with this YouTube channel. And partly it is to give back to the community, but partly it's really helping me work through a lot of my problems. So let's go ahead and get started. So today, there's so many things that I feel like I need to talk about. And I need to be diligent to continue to post because I know that I am not the only person that is struggling with a lot of this. Today I want to kind of give an update on some struggles that I've been having post-op, 11 years post-op, and kind of what's going on there. Right now we're at the end of August 2022, and at the beginning of this year I started Adderall to help with my ADHD. I was a new diagnosis. I'm in my 40s, and when I got that diagnosis, I have other videos talking about it, but like when I got that diagnosis, it answered a lot of questions in my mind on just like why I had a lot of eating disorders and why I was using food and all that good stuff. And I'm going to dive even into more of that for some other videos. But for this video, I really want to address my inability to eat and like what's happened in the last 6 months and how that pertains to complications post vertical sleeve gastrectomy. So when you're in your pre-op stage to have weight loss surgery, one of the big things they have you do is an upper GI to see if you suffer from GERD, which is gastroesophageal reflux disease. And if you suffer from GERD, then you cannot get the vertical sleeve gastrectomy because it will promote GERD. And I've spoken before, but I'm actually a swallowing specialist, a speech language pathologist, and I specialize in swallowing. So I treated a lot of people over the last few years, over the last decade with GERD. And I never really understood, like, I could never truly empathize. Like, I knew anatomy and physiology, like what was going on, but I didn't actually empathize, like what it was like to suffer from severe gastroesophageal reflux. So before you have the surgery, they want to check it all out, make sure you're good, because if you're already suffering from GERD and you get the vertical sleeve, like it's just going to compound an issue. And I will be really honest, like when I got this surgery, I was in my early 30s, and I just really thought it was like, oh, okay, reflux, that's like, really, is that big of a deal? So it is. It's like a really, really big deal. And you would think as somebody who specialized in swallowing, I would be empathetic to that, and I just wasn't. And honestly, I was ignorant to what that was like just because I had never really suffered from reflux. Like, I would get heartburn from time to time, but never like actual, GERD. And so at the time in my early 30s, I didn't suffer from severe reflux, so I qualified for the vertical sleeve gastrectomy. It was still new. They were just now considering it non-experimental, and I got the surgery. And as I got older, I started getting more and more and more heartburn. And like certain foods would cause it, like, foods with yeast, like breads, like sourdough breads, obviously tomato foods, things like that would cause reflux. But over like the last, I would say like 4 or 5 years, the reflux has gotten worse and worse and worse and worse. Like no matter what I was eating, there would always be like right about here, I'd always feel a little burning. And it'd be like annoying, but it wasn't really anything too horrendous. Then in the last 2 years, 3 years, it's gotten worse and worse and worse. And there's certain things that will stimulate GERD, like coffee, caffeine, which I've been drinking more and more of, alcohol, which I've been drinking more and more of. Not so much lately, but like in the past I had. And like I mentioned, some of those other, acid foods. But the reflux has gotten worse and worse and worse. And then in January, I started Adderall, which kind of took away my head hunger situation. So I knew that there was going to be a natural decrease in my intake, specifically secondary to Adderall, just because it is an appetite suppressant. And because of the surgery, I personally don't feel hunger. Some people do, but I just don't feel hunger. but I still had head hunger. So I was about like 209 back in January, and I slowly started losing weight, and I attributed it to the Adderall just because I wasn't eating that much, or I'd like forget to eat. I just wouldn't think about it because I didn't have any head hunger. But simultaneously, I started to notice that my reflux was like getting worse, and then I was vomiting more. So like I would eat food and I would feel food start getting stuck here. And just anatomy lesson from a swallowing specialist. And you have two sphincters, one that's here on your upper esophageal sphincter, and then one that's down about here. And this one has to open up when food goes down into the esophagus, and then this one opens up into your stomach or your pouch, after the vertical sleeve. So I already knew like this sphincter wasn't fully like closing or opening, and so like reflux was coming up, and it was coming up to the level and spilling over into my airway. So I was coughing more, just a lot of issues, and I would feel food get stuck here. And again, as a swallowing specialist, I'm kind of like, I know too much. Like I know enough to be dangerous, if that makes sense. So I'm like self-diagnosing, going, okay, well, do I have like a herniation? Do I have maybe a stricture? Do I have maybe esophageal paresis, meaning that the esophagus isn't pushing the food down well enough, secondary to gastroesophageal reflux? Because if you have enough acid that comes up into the esophagus, it'll burn the esophagus, right? Which can cause something called Barrett's esophagus. Probably not saying that right. Barrett's esophagus, which is the leading causation of esophageal cancer. So of course, like all of this is feeding in my brain of like, oh my gosh, what if I have cancer? What if I have a stricture? What if I have all these things? In the meantime, I'm eating less and less and less and less, and I'm losing more and more and more weight. In some other videos, I don't know how much actually I've talked about my eating disorder, and I probably need to do a whole video just on that, but I talk a lot about just anytime you have to have your stomach removed, you obviously have an eating disorder, you've got disordered eating. And I do believe that there's a difference between disordered eating and an eating disorder, but I have a full-blown eating disorder that rears its ugly head at certain times. And because of the Adderall, I wasn't eating as much. And then because of actually a functional, whatever is going on in here, I've been throwing up more and more and just can't keep food down. I feel food getting stuck here and coming back up. And it's like progressively getting worse. Which then like now I'm down to like 183, and I started at 209. And I'm 5'8". And I'm losing weight. I'm getting thinner and thinner and thinner, which there's like part of me in my mind kind of loving that, because it's like, oh, sweet. I'm not even having to work at it. I'm just losing weight. And that's nice. But knowing that there's also like a fear portion, because I'm recognizing the fact that it is a functional problem with swallowing, and I'm losing control of that. So I only have about 15 more pounds that I can lose, and then I'm now in a pretty massive deficit. Also, when you're only able to get about 500 to 600 calories a day down with food and the rest is liquid, you're losing muscle and you're losing tissue. And somebody in my 40s, I can't afford to lose any more tissue because I'm starting to look older and older. I'm noticing it in my arms. I'm noticing it in my legs. Like it's not an attractive weight loss. Let's just say it that way. I'm starting to look haggard. I'm starting to just like, I look bad. I mean, I look fine, but like I've only got a little bit more, and internally what's happening to me, dietary wise is starting to show. Like even now you can see how swollen underneath my eyes it looks. Like I've never had that bad of swelling, and I slept quite a bit last night. I'm looking haggard. That would be the only way I can say, and that's because I am haggard. Just because I'm losing weight, maybe my clothes fits better, doesn't mean I'm healthy on the inside. And right now, I'm just, in all honesty, I'm not healthy on the inside. There's no way I'm getting enough nutritional value, calories or not calories. I'm not keeping down enough nutritional value. And so I do have an appointment on August 1st, and I will come back on here and kind of share what happens there. My guess is that we're going to order an upper GI. And, you know, I have a few fears, in all honesty. Like, I keep saying in all honesty. And I think I'm saying in all honesty a lot is because I keep lying to myself that this will just fix itself, and it's just not going to fix itself. So here are my fears. My fears, number one, is that they'll stop the Adderall. Now, I don't take my Adderall every day. I take it maybe every 3 days or sometimes once a day, just kind of as needed. It's a short acting, but because it also coincides with the increased gastroesophageal reflux, my concern is she's going to associate those two things together and possibly stop my Adderall, which does make me a little anxious because it really has helped me so much be functional when I need it. Of course, this is me jumping to the end, which is what I always freaking do. Okay, so that's my first concern. My second concern is they're gonna do a upper GI, and like, obviously my biggest concern is cancer, which it's probably not cancer, but like a tumor or something, but like that's my fear. So I'm just gonna put that out there. And then my third concern is it's like a stricture, or it's, you know, the esophagus isn't moving the food down well enough because of the reflux, which is essentially what I think it is. And from my research, the only like fix for that is getting the Roux-en-Y. And I've posted other pictures or other videos about, I think, that concern. I don't even watch my videos again, so sometimes I forget what I said. So sorry if I'm being super redundant, but those are my concerns. Like, I really don't want to have another surgery. I never wanted a Roux-en-Y. I never wanted a gastric bypass. I never wanted rerouting. I always wanted to keep my anatomy the same and just have a smaller pouch. And I'm getting older, but I'm only 42, and I'm concerned of like all the other issues I'm gonna have with a Roux-en-Y. And I have friends that have gotten the Roux-en-Y and are doing really well and like love it, and it's like great for them. And I'm sure it wouldn't be the biggest problem, but like I think as I'm playing around with all these fears and like jumping to the end of all of this conclusions of like, it might not even be any of this, but I think because of my eating disorder, there's part of me that's like afraid of getting another surgery, and then what if I put all my weight back on, you know? Even though that's a gastric bypass, which is what people get to lose weight. So I don't know, it's a pretty messed up way of thinking, and I know it's a messed up way of thinking, but I need people to understand, like, and hear somebody who's over a decade post-op still dealing with this crap. Because I really thought that getting this surgery, and again, I would do the surgery all over again. It's the best thing I ever did for myself. That all being said, I was like, thought that once I lost my weight and I kept my weight down, which I have for over a decade, that it would be over, you know, like I wouldn't have to perseverate on the scale or food or that crap. And like, I just didn't want this, you know? And I'm starting to realize now that I'm in my 40s, and I'm still dealing with weight and food and disordered eating and eating disorders and, you know, actual functional problems. It's like, it's kind of exhausting, and I'm kind of over it, but I'm also realizing that I probably never should have lost my connection with people who have had this surgery and who struggle with eating disorders. Like, keeping that community is really, really important. And that's why I really wanted to make this video. I've realized that hearing other people dealing with the same thing that I'm also dealing with has helped me categorize like my issues and try to get to the deeper meat of what my concern is. And as I've slowly been working through the inner voices and my inner monologue and like my concerns and why am I putting off the doctor's appointment, I'm realizing that there's an actual functional problem that I'm scared of having to have another surgery. And then there's also a head problem of like but shoot, I've lost over 30 pounds. Like, that's awesome, you know? And I've lost over 30 pounds, but I'm probably more unhealthy now than I've been in years. So I don't know. I don't have a fix, you know? I don't have the answer, and I'm really, really scared. Like, this is the most scared I've been regarding my health since I had a hysterectomy. And when I went and got tests for that, when I was essentially bleeding out secondary to fibroids, and I had to have blood transfusions, and like, it went so fast, you know, medically, they were like, you're gonna die. And I was like, wait, what? I can die from my period, you know? And they're like, no, for reals, you can die. Your hemoglobin's at 5.8 and you're dropping. You have to I got bags of blood, like, you know? And I know my body well enough to know that I've let this go for too long. And at this point, I'm kind of in a triage mode, and that's a little bit of, I think, what's scaring me is my health, like the decisions and the things that happen after the first, when I go see my doctor, might be out of my control. And I don't know what those repercussions are, and I'm scared. And I don't have an answer to that fear other than I've committed to keeping that doctor's appointment, but everything inside of me wants to cancel it because I just don't want to know what the problem is, you know? So that's where I'm at. I'm down weight. I look haggard. I feel haggard. I feel really tired physically all the time. I'm just not, my body's not getting fed right now. And I don't know what the answer is, you know? And I think if I was talking to somebody, if I was like talking to myself, I think, what would I tell myself? What advice would I give myself if I was talking to myself? And I think the advice I would say is you don't know what you don't know, and it really might not be that big of a deal. And it's important to ask for help, and it's important to be honest, and it's important to acknowledge things that are uncomfortable to acknowledge, like eating disorders and kind of enjoying losing weight, even though it's in an unhealthy way, and acknowledging that I can't continue to live like this, and acknowledging that it is scary, and honoring those feelings, but still moving forward in strength and in education and getting the options. I think my biggest concern is I might not have options. And that's a little scary. That's a little scary. But again, that's me jumping from A to Z, right? So I have a few more videos I want to make about like the whole ADHD thing and learning a lot of stuff, and it all, like, it's so all plays in together. I'm learning. But health-wise, 11 years post-op, I am looking at one of the big, what do they call it? Like, problems with the surgery that can happen. I'm looking at the number one problem, and being one of those people that has to have, see, look at, I don't even know, corrective surgery. That might not even be the issue, but it could be. And so I'm going to be honest about that. I, again, would have done this, even if I would have known 11 years post-op, I would have to get another surgery. If I would have known that this was going to be the end, I would have still do that surgery the way I did it. I can say that with confidence, because this surgery has literally saved my life, but I cannot allow my life being saved to be cut short because now I'm scared of the next step, you know? How many times have I said that? Anyway, drop your questions in the comments and I will do my best to get back to people. And if you're anything you want me to talk about, or anything that you wish you would have known, or anything that you're struggling with, let me know. I need to commit to posting these because these are so helpful for me. Just smacking myself here. To work it out. And something like I work in my head or I talk to friends about, but I'm like, I need to put that out there because I think that's me owning my commitment. And by me putting this out here to you guys, it's me saying, no, I'm going to put myself first and I'm going to follow up with this appointment and I'm not going to back down. So I care about you guys. I care about your health. Please, please, please. Your health is number one. All the other stuff is number two. And I'm trying to live that truth. Take care.